Okay, here is my consent form. Jay, do you consent to being in my video?
Yes.
Okay, here is the room scan. Okay. All right. Okay, so first I'm just going to do my opening. So I'm going to I'm going to wash my hands. I'm going to introduce myself. I'm Cami. I'm going to be your nursing student today. I'm going to identify my patient with 2 identifiers. Can I have your name and your birthday, please?
Julian Barnes, 7/30/101.
Okay, and then I would scan his wristband, making sure those two match up, which they do. So then I'm just going to explain the procedure. I'm going to be doing a head-to-toe assessment with you today, and then I would go ahead and provide privacy. So first I'm just going to do a general inspection of his appearance. How are you feeling today, sir?
Good.
Okay, so he does state that he is feeling good. That can be expressed by his appearance. He seems to be content. He is sitting upright and erect. He is relaxed. And then what mood would you describe how you're feeling today?
Happy.
So he is feeling happy. So that can also be proven by he's smiling, and again, he is relaxed and content. So then his speech is clear and articulate. His hygiene, he does appear to be clean. He is dressed for the occasion, and his overall appearance seems to be in good health. So now his speech is clear and articulate. Can't remember if I said that or not. And now I'm going to just ask him a few questions about his level of consciousness. So can you answer a few questions for me?
Yes.
Okay. What's your name?
Julian Barnes.
Where are we?
Bowling Green.
What are we doing?
Head-to-toe assessment.
And what time is it? Any time.
3:44.
Okay. So he is alert and oriented times 4. So now I'm going to go in and I'm going to take some of his vitals. So first I would take his pulse. I'm going to determine if it is regular, which it is, so I can just count how many beats I feel for 30 seconds. Okay, so I did get 40 beats per minute, or per 30 seconds, so I'd multiply by 2. So that is 80 beats per minute, which does fall within the normal range of 60 to 100 beats per minute. If he was above 100, he would be tachycardic, and if he was below, he'd be bradycardic. The pulse was strong and elastic. I would grade it a +3. And then now I'm going to go ahead and take his respirations. So can you just breathe normally for me? Again, I'm checking to make sure they're regular, which they do seem to be regular. He's not, he doesn't have any labor breathing. So I can go ahead and just count again for 30 seconds. Just breathe normally for me. Okay, so I did count about 13 breaths per minute, which does fall within the 12 to 20 respiration range. They were a little shallow, but I could tell that he was breathing normally. He isn't using any accessory muscles to breathe. So now I'm going to take blood pressure. So, and his depth for his respirations were about 1 to 2 inches. So now I'm going to take blood pressure. So first I need to decide, can you sit up straight for me? I'm going to determine which arm to put it on. So I would check for any IVs or AV fistulas or dialysis ports, which he does not have, so I will be using it on the right arm. And first, so now I need to measure the cuff. So I'm going to, the bladder should cover 80% and the width should be 40. Which this does fit my patient. So now I will go ahead and put it on and take my blood pressure. I would locate the brachial artery. So I did get his blood pressure at about 110/80, which does fall within the normal ranges of the systolic being 90 to 120 and the diastolic being 60 to 80. So if he would have hypertension if his systolic was from 120 to 129 and his diastolic was anything less than 80. Hypertension stage 1 is systolic 130 to 139, diastolic 80 to 89, and the hypertension stage 2 would be systolic 140 or above and the diastolic 90 or above. So now I can go ahead and move on to his facial features. So I'm just going to inspect his facial features. His nose is midline, as well as his mouth, and the corner of his eyes do line up with the tips of his ears. So they are symmetrical at rest. And then can you just do a few movements for me? Raise your eyebrows, puff your cheeks, and smile. So the facial features were also symmetrical with movement. So now I can go ahead and do Perla. And again, when inspecting his face, I don't notice any kinds of color variations or lesions on his face. So now I'm going to do Perla. So first I'm just going to look at his eyes. I'm seeing if his pupils are equal and round, which they are. They seem to be about 4 millimeters, and they are both round, so they are equal. So now I'm going to test indirect and direct light. So just go ahead and look at my nose for me. Okay, so they are reactive to direct light, and now indirect. And they are also reactive to indirect light. So now I'm going to test for accommodation, so go ahead and look at the tip of my pen light and just follow it all the way in. Perfect. So the pupil or the eyes did constrict and converge, so that does mean they're accommodated. I didn't notice any nystagmus or sluggish pupils when inspecting that. So now I'm going to go ahead and move on to inspecting his arms and his hands. So I am inspecting both anteriorly, posteriorly, and on the sides. So I don't notice any kinds of color variation bilaterally. They seem to be a pale beige color. His hair is distributed evenly. I do see one lesion on the antecubital region in the form of a scar. It's about an inch long, but it is healed and there is no signs of infection or drainage. On his hands, I do not notice any skin breakdown in between his fingers, no ulcerations on his hands or anything like that. So now I can go ahead and move into the chest and the thorax. So if you'll go ahead and remove your shirt for me. Okay, so now I'm just going to inspect his chest. I'm just inspecting the anatomical features of it. So I do not notice any concave or barrel chest there. So now I can go ahead and listen to the lung sounds of the chest. So I'm going to start above the clavicle. Just go ahead and relax for me and just, no, sit up straight. Come on, I got to get this under 20 minutes. So I'm going to start above the scapula. Just go ahead and breathe normally for me. Good. Okay, so on the anterior side, his lung sounds were clear. I didn't notice any wheezing or bronchi. So can you turn around for me now? I'm going to listen to him on your back.
Turn around.
Yeah? There. That's fine. Okay, so if you just go ahead and take some deep breaths for me. I need you to turn this way so they can, sorry. Okay. I'm just trying to avoid any bone while listening to his lung sounds. Okay, you can turn around back again. So again, I did not hear any diminished lung sounds. They were clear, no wheezing or bronchi present. So now I can go ahead and listen to his heart. So I'm going to listen to the 6 heart sounds. So I'm going to start with the aortic heart sound, which is second intercostal space, right sternal border. The pulmonic is second intercostal space, left sternal border. Erb's point is third intercostal space, left sternal border. Tricuspid is third intercostal space, left sternal border. And mitral is fifth intercostal space, medial to the midclavicular line. So his heart sounds were normal. I heard S1 sounds loudest at the tricuspid and mitral area, and S2 loudest at the aortic and pulmonic. I didn't notice any murmurs. So now I'll go ahead and go into his abdomen. So can you go ahead and lay down for me? Hurry, because I'm running out of time. Okay, so I'm just gonna drape this across my patient. Yeah. So I would cover the upper extremities with the blanket and then, oh God, they can't see. No. Okay. So now I'm just inspecting. So I'm just looking for contour. The abdomen is not distended, it is flat. When I look at the 4 quadrants, the umbilicus is symmetrical and midline. I don't notice any color variations or lesions on the abdomen. So now I am going to auscultate for bowel sounds. So I am just listening. Okay, and I started in the right lower quadrant. I did hear about 15 vowel sounds, which does fall within the normal range of 5 to 30. So he does have an active bowel. So now I'm going to palpate. Are you having any pain in your abdomen?
No.
Okay, so the patient does not state he is having any pain in his abdomen, so I can start in the right lower quadrant again. If he was having pain, I would start in the quadrant opposite to the quadrant where the pain is located, so that I will end in the quadrant with the pain. So I'm going to go ahead and palpate. Let me know if you feel any pain. Any pain?
No.
Okay, so the patient did not know any pain. It did feel tender. It was not rigid at all. The patient did not grimace or guard while I was palpating. That is good. So now I'm done with the abdomen. You can sit back up for me. Okay, so now I'm going to inspect the legs, feet, and the toes. So I'm just going to, again, inspect them anterior, posteriorly, and on the sides. So I'm just checking for, I'm inspecting, I'm looking at color. I see pale beige all around, no color variations, bilaterally. The hair distribution is evenly distributed. They seem to be symmetrical bilaterally as well, and I do not notice any venous patterning. So now I'm just going to inspect for lesions. So while I was inspecting, I did see one on the outside of his calf. It is about the size of a nickel, but it is a secondary lesion in the form of a scar, but it is flat, it's healed. I don't see any kind of infection or anything like that. I do see a few primary lesions distributed throughout the legs, but they are flat and pinpoint and round. So, and I don't notice any vascular lesions at the moment. So now I'm just going to go ahead and palpate his legs. So I'm just, go ahead and sit back for me. So I'm just palpating. I'm going to start up here. I'm trying to feel for any kinds of fluid. And let me know if you have any kind of pain, especially around the joints. I know I'm trying. And I'm going to go all the way to the toes. Okay. Any pain?
No.
All the way to the feet. Okay, so I did not notice any edema while I was palpating. He said he did not say he had any pain. So now I'm going to do the temperature with the dorsal side of my hand. Okay. So the temperature did get cooler as I moved down, which is an expected finding. His legs were dry, and then, the temperature got cooler as I go down. Are you having any numbness or tingling in your legs?
No.
So the patient says no. If he was, I would have to determine how far up the extremities those sensations are going and report that to the physician. So now I'm going to do plantar and dorsiflexion. So first I'm going to test dorsiflexion. So go ahead and push down for me. Okay. And now I'm going to do plantar flexion. Go ahead and pull up. Good. So the dorsi and plantar flexion were both strong and equal bilaterally. So now I can go ahead and inspect for any ulcerations on the legs, which I didn't see any when I was inspecting, and then the pressure points. So I don't see any on the bottoms of the feet or the heels or in between the toes. No skin breakdown and no ulcerations. So now I'm going to do the pulses. So first I'm going to locate the posterior tibialis pulse, which is located on the medial malleolus. So this pulse is equal bilaterally. It is faint, but that's normal with these kinds of pulses. But I can feel it on the inside of his ankle and the medial malleolus. I would grade it probably a +2, but they are equal bilaterally right here. So now I'm going to do the dorsalis pedis pulse, which is on the top aspect of his foot. Which again, this is equal bilaterally. I would also grade it a +2, and they were both elastic, both the posterior tibialis and the dorsalis pedis. So now I'm finished up with that, so I would just go and see if he has any kinds of devices or Foleys or IVs that I need to attend to, which he does not. He does not have any oxygen devices because he is breathing room air. So that would finish up my assessment. So then I would just go ahead and position my patient for comfort. I would put the bed in lowest position, side rails up ×2, dispose of any of my supplies, and then go document my findings and put the collet and any belongings within reach.